one of the things you mentioned towards the end there is that now you want your healthcare professionals to work in partnership with you, and to work with you around solving problems which come up around your condition. And that's a beautiful, I think, entry into the work of Andrew. And what we're going to move on now is really clinician as the enabler, and the skills, looking at this through the practitioner lens, as it were. What skills does the workforce need to actually empower people like Lynn, support people like Lynn on that journey, from that journey of being passive, feeling overwhelmed, and then being able to work in partnership with them. So Andrew, over to you.
Thank you very much, Jim. When Jim asked me to get involved in this webinar, which I'm super happy to join you with, it's picking up the challenge of looking at, well, we do want people to be more activated. You know, Lynn described it beautifully in terms of we want them to be able to get involved with balancing the different balls in the air, moving from level 1, you know, to more of a self-managing position. And to do that, and to support people to do that, also takes a bit of a shift on the side of a clinician or a practitioner, or of lay people using the approaches. So this is where the concept of health coaching comes into it, in terms of supporting self-management. So the way we think about health coaching is that it generally is aimed at supporting people gain the knowledge, skills, and confidence to become more active in their care, so that they can reach their self-determined health and well-being goals. And this is kind of the stock definition, but it really picks up on the important points that Lynn was bringing. And for me, it also means really helping people to think, to really get engaged, to really raise their awareness and increase their sense of responsibility for health and well-being. So, you know, generally speaking, many healthcare systems across the world would like their patients and would like the people who use their services to be more activated. They want people to be more self-managing, because of course that has tremendous cost savings, but most importantly, tremendous impacts for quality of life. And for many people, it also means that if they do self-manage, it's not going to get rid of the problem. It's just going to improve their sense of well-being and improve their way of enjoying life in the midst of, as Lynn explained, a number of long-term conditions. So I also think about health coaching as an opportunity to support people to change their relationship to the challenge or the problem they're experiencing. And many of you will probably know that coaching has a background from sport, moving into business and development and performance, before it's come into being a model that we use in health and well-being. As a psychologist myself, it was quite important for me to recognize where I was deeply embedded in more of a biomedical approach, and coaching really shifted the way that I did my practice in working with people. It's important to say that coaching isn't a replacement for any of the other themes and ideas that I'm sure many of you are very accustomed to. So, you know, coaching supports personalized care. It's a way of supporting application. It's one of the few things that has been found to actually help people advance through those activation levels with health literacy. It enables more shared decision-making and asset-based approaches, and it's a good way to structure conversations so that it leads to good care and support planning. It also, some of the other things, it supports people to work together using a similar frame with the various areas such as social prescribing, which in the UK is a very big area of application for health coaching. But the main point of this is that health coaching is around a way of having a conversation, a way of structuring a conversation so that it can lead to an outcome, which engages people more in that conversation rather than being a telling conversation. The reason why people are so interested in it at the moment, and of course, you know, I remember working with coaching some, you know, 25, 30 years ago with introducing it in part of a fourth year medical school curriculum. So it's not new, it's been around for a long time. But it's becoming more and more favored as an approach because we need to shift the culture, the traditional culture of people both being expected to be told what to do in terms of managing their health, and also practitioners falling into the habit of just telling people what to do. So in this traditional model, practitioners seem to be seen as the expert. They're kind of considered to be making decisions. The person might believe it's the practitioner's role to fix them. They suggest the goals. The focus is on the things outside of the person, the extrinsic motivators, and you know, an oversimplified way of explaining that is that it's kind of the carrot and stick motivation, which many healthcare systems are very good at reinforcing. So you know, if you do the right thing, we give you the carrot. If you don't, you've got to avoid the stick. And that's outside of the person, which isn't very internally motivating. And what tends to happen in those environments, in those kind of conversations, is people don't think about the more psychological factors which support someone to change. And if we could move on, it leads to people like Angela Coulter, who's a well-known leader in shared decision making and person-centered care, saying that we really need to change. And this is 10 years ago now, and I think we're starting to really see the impact of this kind of thinking as we move on. So if we treat people as passive, they remain passive. If we treat people as partners, they're much more likely to be partners. And some of the beautiful examples that Lynn was offering are great evidence of that. It leads to people like Ruth Wolever in the States saying that we need to sort of reconceptualize the relationship that we think about when we look at the role of a person and the role of a practitioner in health and care. And Ruth is responsible for publishing, I think, about 8 now randomized controlled trials in health coaching, showing really positive impacts around long-term conditions. And she's looked at something like 200 definitions and have come up with a consensus model for what these new roles need to look like. And I really like the way she's described it, because it really demonstrates the partnership which is needed in order to shift the way that people operate around these things. So she talked about the role of the practitioner being someone who's trained in some behavior change theory and motivational strategies with communication techniques to help people develop intrinsic motivation and to obtain the skills they need to make sustainable change. The role of the person is to at least partially determine their goals and be engaged in a self-discovery and active learning process to work towards those goals while self-managing it in the context of more of a coaching orientated relationship with their practitioner. And I just think it's a really nice way of really picking up on Lynn's point, which is it takes both sides. You know, if we want to get a shift in this dynamic and a change in the way people self-manage, we as practitioners need to change the way we're having the conversation. What that means is that the coaching approach is all about encouraging people to be resourceful. So it's based on the recognition that first, people are resourceful. You know, they are the expert in their own life, and they are much more resourceful than they often think they are, but creating some time and space allows people to actually get involved in that. People in a more of a coaching approach, people are involved in generating their own solutions. The decisions are made in partnership. The person believes they have an active role to play in their own health, and they're supported to define and measure their own goals. Now, the focus is a bit more on the intrinsic factors as well as the extrinsic motivators. So with that in mind, a big part of coaching, and I'm going to show you a model about that in a minute, is around helping people to generate intrinsic motivation, because if they have it, they're much more likely to take action. And with this in mind, we address more of the psychological factors involved in change. Some of you will have heard of coaching as a general skill, and it is a great set of tools and techniques for people to use, but using it in the health and care context means that we can take advantage of some of the great knowledge and advances in behavior change science and health psychology, and come up with models which also draw on the skills, knowledge, and expertise of the practitioners. So there's a lot of stuff in coaching around goal setting and the various models and ranges, approaches, the idea of awareness and responsibility, challenge, those sort of things which are useful. And when we pick up the concepts from behavior change science, which is another click, around behavior change theory, social cognition, patient activation, motivation interviewing, some positive psychology, CBT concepts, and also involve the next one, which is the knowledge and skills, the expertise of the person offering it, then it can create quite a powerful recipe in supporting people to self-manage. So, it's not just coaching, it's coaching utilizing the knowledge and the skills of the practitioner and drawing on some of the clever things we know that really support people from a behavior change perspective. If you look at the literature, there are some things that we know really support positive conversations and good coaching orientated conversations in any kind of health and well-being or health and social care setting. So being prepared, actually spending some time preparing and removing distractions has been found to be super important. Having goals, generating active listening, using reflective processes to help people think and encourage ownership, viewing to take action. All of these things are quite well documented and well evidenced, and most practitioners know about them, but the conditions that many of us work in make it difficult to consistently do that. And most practitioners believe that they are much better listeners than the people that they're meant to be listening to think they are. So and me included, right? So it's normal that people know about these ideas but don't always have an idea of how to put it into action. And the coaching processes, the coaching models that we use in health coaching are designed to support people to have conversations with people so that they can use these kind of skills. And when we were talking about the content of this webinar and thinking about, well, just to get a sense of what are the skills and the processes that people can use when they're drawing on a health coaching approach, we thought that probably the best way to demonstrate that was by showing you and talking you through a model, and then looking at even showing you how we'd use that sort of approach to a conversation with a view to helping you think about what some of the skills and ideas are. Rather than just giving you a list of the skills, we're going to show you a model and then help you unpack it. About the most commonly used model in coaching is the Teagrow Model. It was developed by a guy called John Whitmore, who I was fortunate enough, he was my teacher in coaching. And it runs through a series of stages. So I'm just going to show you them quite quickly here, and then I'm going to go through them in a bit detail in the next bit. So first, it's about having a topic for the conversation. Then it's about establishing a goal, getting a very specific goal for the conversation, which is meaningful for the person. It's about identifying the reality that that person's currently experiencing, which is really about helping them think about what's going on before they consider what options are possible to help them achieve whatever the goal for the conversation is, followed by a sense of the will or the wrap up, the way forward, in the conversation based on a plan of action. Now, it would be nice if it was that simple. And of course, people don't operate in straight lines, and it looks a bit more like this in reality. Okay, so you might find that someone tells you about a topic and then they jump into telling you everything in the reality before they drive into talking about the will. But it's not a linear process, and I think it's very, very important to recognize that having really useful coaching conversations means that we adopt a model which recognizes that people don't just follow a process. They are actually going through a thinking experience and a feeling experience, which helps generate intrinsic motivation. So I'm just going to talk you around the different phases of this in more detail with a view of then helping you think about how this is a useful way to structure conversations with people. So this is not one of those models which was theoretically derived. It came from actually looking at coaches who are really effective in what they were doing. And in the first case, what was found is that most coaches who were really good at getting outcomes with people spent some time up front getting an initial understanding of the problem, to get a bit of an idea of what was on the person's mind, getting a sense of what's on the agenda for today, identifying important themes for them, getting a sense of what was important to them to prioritize and bring to the conversation. And with that in mind, it was very much a time for building rapport, getting to know someone, and almost getting a thin slice of understanding what was going on before getting an idea of specifically what the person wanted to focus on for the session. So I'm sure all of you will know that there's the importance of having goals and working towards goals. In the Teagrow model, it's not about a bigger picture goal or a programmatic goal, what someone wants to achieve in the long term. It's about having a goal for the session that you're working with the person around. And what was found in the study of coaches who were really effective is that they were quite good at identifying with a person from all of these things that were on their mind in the topic part, to coming up with something quite specific that they wanted as an outcome from the session. And in doing so, they were able to prioritize and identify really what was important for the person. So all of the discourse we have today around what matters to the person and what's important to them was evidenced, or was a very similar approach to what was happening in coaching. So after they focused on a goal for the session, it was found that the coaches who got great outcomes with people really helped them think about, unpack, and get real proper information about what was happening now. Now it's interesting because the coaches who got the best outcomes didn't just get the person to tell back their same old story. They didn't just get someone to repeat back stuff they'd said 100 times. And I'm sure many of you will know that that's often what happens. People tell the same stories over and over again. The coaches who were really effective actually got the person thinking in this stage. They really supported them to increase their understanding of what they wanted, to really understand the context which might have been why they weren't achieving what they wanted, to help them think, to really raise their awareness about what was going on. So it generated new knowledge, new information, new thinking, rather than just repeating back reality. So we can get a bit dulled into thinking that reality is just telling you what's going on. But in this model, the idea is reality is to understand the broader picture, to raise someone's awareness. After that has happened, then it's about generating options for what's possible to achieve the goal in relationship to the current reality. So you get a sense of the kind of iterative nature of this and the crossing over rather than it just being linear. So it was found that the coaches who were really good at this didn't tell someone what to do, but they raised enough awareness in reality so that people came up with ideas for themselves. And the generation of options were in the person's gift, so that when it came to then taking commitments forward to action in the wrap-up and the will stage, they were more likely to follow through on them. So the will and the wrap-up stage, the coaches who were really good spent time with people really planning their way forward, what the intention of that going forward was. So I hope that gives you a bit of a sense, and the idea that it moves around a bit. And when psychologists like me looked at this model in the early days, we recognized that there was more than just a linear process going on, and in fact that there were two big themes happening. On one side, it's all around raising awareness. Now, of course, there's the crossover between the areas, but you can think about it as having two parts. The awareness raising part, knowing what the person's there for, getting a sense of what they want from the conversation, focusing in on helping them unpack their experience before going to increasing their sense of responsibility through looking at what's possible and what the plan is going forward. And just that in itself is a really, really helpful distinction to make for most practitioners who go straight from knowing what the problem is to jumping straight into what can be done to fix it. Typically, people miss this idea of really unpacking reality. Now, the important part, as the slides show, that when we know and we help someone recognize what they want, and then we spend a lot of time raising awareness of where they are now, which is not what they want, we're generating something that psychologists called cognitive dissonance, which is the difference or the contrast between what I want and what I have. And in coaching, what we do is we really emphasize and stay with the dissonance rather than jumping in to try to solve it for someone. And in many kind of helping professions, the idea is we don't like seeing people in conflict. We don't like seeing them in any sense of dissonance, and we jump to solving the problem for them, or we've been reinforced to solve problems all of our professional clinical lives, so we jump into solution finding. In coaching, we create dissonance, and then we invite someone to resolve their own dissonance, thereby generating more what we call intrinsic motivation. So the idea is that when we resolve our own dissonance, people are much more likely to move forward with those ideas that they have for themselves. People will argue with my ideas as a clinician, as a practitioner all day long. It's almost like we have something inbuilt in us as human beings to argue with other people's advice, or just to not necessarily agree. It's easy to object to it. If someone generates their own ideas, they resolve their own dissonance, it generates what we call intrinsic motivation, and they're much more likely to take action when it comes to moving forward. And that's, I mean, there's lots of other stuff, but that's the basic psychology behind the TGROW model and behind having coaching conversations which raise awareness before asking someone to increase responsibility. The idea is raise awareness before you have a sense of responsibility, which really creates people thinking and coming up with their own ideas. What we thought would be useful is to show you an example of what a coaching conversation looks like. Just a quick example, maybe 10 minutes or so, to show you that process in action. And Jim has very kindly agreed to help me out with this. I don't really know what Jim's going to talk about. It's meant to be a skill that you can use for anything, but what we want to do is give you a brief demonstration of the model on a real topic. So I'm going to invite you, Jim, to just think of something that's real that might be helpful for people as a demonstration of the model. So what we're going to be asking you to do after we've demonstrated is to think into what you saw in the process, so the skills and the kind of approaches. What did you see me doing, and what did you see the coachee doing? Okay, so if we start with just the first part, Jim, what would be useful for us to focus on for 10 minutes or so?
Yeah, that age-old problem. I'm desperate to increase my exercise activity, and I've been procrastinating on this for a number of months now. I've signed up to 2 programs, paid the fee, and never done anything. So it's starting to get expensive.
Yeah, well, I imagine. And is it something that's been occurring to you for a while, or is it just recent? Or
No, it's been a while. It really is an ongoing theme. There's a couple of bits that I have managed. So the dog's been walked a bit more.
yeah.
Bless him. So he's a beneficiary. So I have managed to improve that a little bit. But there is some specific exercises I really need to do, because there are consequences as well for not doing it. But I do just I'm awful, terrible. Yeah.
Yeah. Okay. And is there anything that makes that specifically important to talk about now? I don't mean to put you on the spot around it. You don't have to tell us all the detail, but is there something that makes it important?
There's quite a long list, but to summarize, one, I've got a bad back, so I need to do it for that. Secondly, I've got a bad ankle where I smashed it up a few years ago, and it helps with keeping that mobile. And third, I do a sport which actually involves horses, so it requires a certain amount of core strength as well, which I need to do. So yeah,
Yeah, so there's some good reasons actually. So tell me.
Oh, the reasons are great.
Yeah. Well, tell me what would be helpful to get from our conversation then, if we've got some time to invest in this.
It's really just I know what I need to do. Yeah, I know what I need to do. I'm even signed up to, which is now the 3rd week of a Facebook group, which is now the 3rd week, and I haven't done anything. I read the post, and that's it. I just cannot seem to get going with this. Yeah.
So by the end of this conversation, for it to be useful, what would you have?
Motivation. Yeah, motivation and commitment. Yeah.
And what would convey to you that you did have some motivation and commitment at the end?
I would actually feel that I genuinely was going to do what I've agreed to do. Yeah.
Okay. Yeah. And have you, just to be really clear, have you already got an idea of those things that you've agreed to do?
In a way, like I said, I'm signed up to the program. I paid my fee. It's carrying on without me. The train's left the station. I'm on the platform. So yeah.
Increased motivation and like you're going to be convinced that you're going to do it.
Yeah.
Okay, I'm with you. So tell me what's going on now with your motivation around following through on what you said you'd do.
It's sort of, it's one, I know I need to do it.
Yeah.
As it were. I guess in my mind, I still got a little bit of time before I really have to start. Although previous years that hasn't always sort of worked either. So, sorry, what was the question again?
Well, I'm just asking you about your relationship with being motivated or not.
Yeah, it's just, it feels important, and it feels like something I, need to do, want to do, but I don't know what it is. There's just something which just keeps slipping away. So I can't quite make that final bit of commitment, if that sort of makes sense.
Yeah, well, it sounds to me like it's one of those things which isn't really front of mind. Is that right?
Yeah, it is front of mind, because I notice myself not doing it every day. It's a mass sort of front of mind. It's a bit like, a wall you haven't decorated in a bedroom. You walk past it every day and think, I must do that tomorrow.
Yeah. Yeah, I know, I really hear you, and I'm sure you're not the only one, actually. So, tell me, what do you normally do when you're in those sort of situations? I mean, have there been other things in your life where you want to do it, but you don't?
Yeah, I mean, most things when I'm in that situation, I either get on and do it because
Yeah.
I need to, or I just decide actually it's not that important at all and dismiss it. This one seems to be slightly different in that I
Yeah.
can't dismiss it, nor
Can't
can I
dismiss it.
quite get on with it either. Yeah.
Yeah. And knowing yourself as you do, what else is relevant in your experience of not what you can't dismiss it and you can't get on with it? What else is important to know about that?
I guess that I'm lazy. So there is I can procrastinate extremely easily.
Yeah.
And I guess there's a certain sort of degree of is all too much effort, as it were, a sort of a can't be bothered sort of thing.
Yeah. What would other people say about it?
They'd probably just sort of shake their heads and just go, I don't know why you just don't go on with it.
Yeah.
So what's the problem? What's stopping you? You know what you need to do. No one's telling you to do other things. No one's making you do something else at lunchtime or anything else. Yeah. So,
and when something is really important to you, that you are able to get your action behind, what tends to happen then?
just get on and do it. Yeah.
Something clicks.
Yeah, just click. Yeah, no, I'll do it. Yeah.
So I'm curious about, just sort of looking at the time, and I'm thinking about what sort of ideas might you have around how to get it to that click that you mentioned? What might support that?
I don't know. It's almost like I know once it's done, 3 months down the line, I know I really appreciated that I did it.
Yes.
What I can't do at the moment is just get over the initial, this is all just hard work sort of thing.
Yeah. So what I mean, I'm not saying you have to do any of these things, but what might someone do to just do it, just get on with it and get over the initial obstacle of getting started?
I imagine when we come off this webinar, would get up, go next door, log on to the Facebook site and just go, right, I'm just going to do 10 minutes, 5 minutes, whatever. I'm just going to do something. It doesn't matter how much I do, it's just something. Even if it's just 2 minutes, it doesn't matter. Just the principle of actually done it once. Yeah.
So that's one idea. It's like just doing something.
Yeah. Just do something. Don't worry about doing it half an hour, all of it. Just actually get into that space of actually doing it, turn it on, and even just doing the warm up or something. Actually, that will work. Actually.
What else could someone do?
I'm not sure. I mean, I've tried everything else. I mean, always start putting it in your diary, put a reminder on your phone, tell my partner, done all of that. It doesn't really work because I can ignore it all. An alarm on the phone, I just go click.
You mentioned something about a bit of a time frame around it. Around, you've only got a few, you can put it off a little while longer till you have to do it. What's relevant about that? We don't have to go into detail, but what's relevant about that for you here?
Well, clearly, hopefully the competition season will start March, April, so I need to be building up fitness for that. So obviously, the closer I get to that, the more I run out of time. That's no guarantee because previous years I still have not done anything whatsoever. So although there is that element, I've said sort of this year I will actually start earlier. Yeah.
And who have you said that to that matters?
Oh, anyone who asks. Yeah, but that's what I mean. But the usual stuff it isn't working. I know all the techniques. I know all the things you shouldn't.
Yeah. So knowing yourself as you do, and you suggested just doing something is better than nothing, and that's one way. But knowing yourself as you do, what advice would you offer yourself at this point?
Well, I said earlier, it would be just, when you finished activities such as this now, I know I don't have to go straight into something else, just to get up, go next door, and just do it.
Okay.
There's no and ahhing, no thinking, oh, I'll do it at 9 o'clock tomorrow morning or something, but just quite simply, do it with immediacy. Yeah, just do the one thing, just do it once. Yeah, just get started.
How does that feel as a way forward for you?
Yeah, no, actually, I almost could almost get excited about that. A mild sense of dread.
Yeah.
And I've just committed to 101 people that I'm going to go. But actually, that is it. Because I can gameplay every single technique in the book.
I imagine you can.
Yeah. I do. I just need to get up and do it. Yeah.
Okay.
I'm tempted to hand over to Lynn and go and do it now.
So yeah, and in terms of making sure there aren't any game playing going on, what is it that you're practically going to do as a result of this conversation?
I'd say I have joined up to a closed YouTube group, so I will go on, log on to that and bring up the first video and just make a start. Yeah. Don't have to do it all, don't have to worry about completing it. It's just actually doing it once. Yeah.
And is there anything that might make, because I believe you when you say you're just going to do it once and that's great. Is there anything that you might need to put in place to make sure of it?
No, I've just got to do it. No, it is. The door's just there. Yeah, the door's just there.
Terrific.
Yeah.
Excellent.
Yeah.
All right, Jim. Great. Yeah. Well, thanks very much for that topic. Hopefully you get a sense of the Teagrow. I think that was about 10 minutes, just under 10 minutes, just talking around it. Can I just invite you to think what you noticed around the process? Did you see us sort of following the different stages? What did you see me doing? And what did you see Jim doing? So just have a bit of a think for yourself. And Jim, what was your experience of that? Because I know it's, obviously you've thought about these things before, about coaching, all that kind of stuff.
Yeah. A level of discomfort. There's loads of people for putting stuff in the questions, actually.
Oh, yeah, I can't see them, actually.
The people are saying, only asked questions, didn't give any advice. I came up with the ideas, structured conversation, but flexible and adapting to responses. Could see my discomfort, cognitive dissonance, which is absolutely right, because it did raise that actually. It actually raised my discomfort. I've got comfortable with not doing. I say, I know all the techniques.
Of course you do.
I know them all, and I'd almost become immune to them. But what it did, it will actually raise that discomfort of not doing it, which allowed the realization to come through that I've just literally just got to go and do it. There's no backing around. Think about it, do it. Yeah.
What I was consciously trying to do in the coaching was to keep it over on the topic goal reality side. So, to actually enhance some of that, in a nice way, some of that, not discomfort, but the kind of dissonance between, because of course Jim knows this, and of course he knows what his own process is. But if I can keep it there long enough, then there's likely to have some option pop through, which is going to help resolve that. Now, if I jump straight to options, then it's less likely to work. So Jim, I could have said, well, Jim, why don't you put it in your diary and just make a time every day? What would you have said?
I might well have become compliant to that, actually.
You might have.
I might well have done. I might well have gone, yeah. I might have gone, yeah, that's not a bad idea. I could try that. Oddly enough, yeah, I might have gone down the compliance route.
Yeah, maybe. Yeah, in my experience, people go down the compliance route to shut you up, and does it actually give them the behaviour change afterwards? But in this case, I'm hopeful, and I actually believe it's true that that if the person comes up with their own ideas, they're much more likely to follow through on them.
Going back to Lynn, you know, that's very much what she was saying about the process of also the group process on a self-management course as well.
Yeah,
traditional patient education, where people are told what to do, to where groups are encouraged to think, what is it that they want to do?
Hi, I've just put myself on because Jim, I would like to find out how you get on with your goal.
Yes. Okay, I'm really starting to squirm now. Yeah, okay, Lynn, you're on. Yeah, and someone else is saying, I was itching to jump in with options and solutions, but see that it was much better to not do that, but let Jim find his own answers. I did most of the talking, assistant coaching, definitely saw the process working, coach remained neutral without advice, and yeah, coaching was, yeah, I was being 100% honest, I assure you.
Yeah, no, I can tell, yeah.
Okay.
Yeah, so I think this is the important thing, is that, you know, these kind of approaches, this kind of model is a much more personalized way of having a conversation with someone, because it's filled with their content. So, you know, when I was trained as a psychologist, I would tell someone what the topic was when they arrived, because I'd had the referral. I'd tell them what the goal for the session was, because I knew in my expert model, this is what they should do now. I would take a history so I could give them the best option, and then on the way out, I'd remind them what they were going to do. And of course, strangely, not many people did it. So, yeah, strangely. So, you know, it got me thinking there must be a better way to have conversations with people, which is where I found it.
However, Andrew, one of the things that I sometimes say is, when a goal is imposed upon you, so for example, physiotherapy, you do your physiotherapy and the goal is to do your exercises. So your goal is imposed upon you, and when you go back and they ask you, have you done your goal, you don't say no, you always say yes, even though you haven't.
Well, yeah, and because it wasn't your goal.
Exactly. So it does not, the way you talked about the first, you know, when you were originally doing it, it doesn't develop trust. It's about trust, isn't it? And rapport.
Yeah, not at all. And I'm completely with you. And, you know, what I'm trying to express is that at the base of a biomedical clinical model is there's an expert telling someone what to do. And that's not really effective when it comes to managing long-term conditions or lifestyle problems, or things where the person has to self-manage, like you were explaining. So we have to change the way we're having conversations with people if we ever want to support self-management.